Hi, I'm Peyton, and I'm reporting from the field of sports exercise science.
Hi, I'm Addie, and I'm reporting from the field of biology.
Hi, I'm Austin, and I'm reporting from the field of physics.
Hi, I'm Ellie, and I'm also reporting from the field of physics. And today our topic of discussion is laser surgery, specifically how effective laser surgery is as compared to typical surgery methods.
Laser surgery is an increasingly used technique due to its greater safety, shorter recovery time, and effectiveness in treatment. Laser surgery is a type of surgery that uses a laser to cut tissue. Examples of this include the laser, scalpel, and otherwise conventional surgery, and soft tissue laser surgery, in which the laser beam vaporizes soft tissue with high water content. Laser surgery has many applications. Some of the most common are tumor removals, preventing blood loss by sealing small blood vessels, and decreasing the spread of tumor cells by sealing lymph vessels. It can also be used for cosmetic purposes, including removal of warts, moles, tattoos, scars, birthmarks, and wrinkles. The most typical use of laser surgery, however, is LASIK eye surgery. This is what we will primarily be focusing on today. LASIK stands for Laser Assisted In Situ Keratomylosis. By using this technique, surgeons are able to reshape parts of the eye to lessen or completely eradicate vision issues caused by eye abnormalities.
In 1917, Albert Einstein first came up with the idea of stimulated emission, but it wasn't until 1960 the first laser was successfully created by Theodore Maiman. The word laser stands for light amplification by stimulated emission of radiation. A laser is composed of 5 parts. The first part is the gain medium. The gain medium utilizes quantum properties to amplify the laser beam through stimulated emission. The second part of the laser is this energy source pump. This part basically takes the radiation waves and makes them a lot stronger. The third part of the laser is the total reflector. The total reflector reflects all of the energy in laser back in the other direction to the partial reflector. The partial reflector allows only the desired type of light through creating the laser beam. The laser beam is what is used for laser surgery.
In an incandescent bulb, light is released from an atom as an electron jumps between orbits with different energy levels, emitting wavelengths of different frequencies. In lasers, electrons jump from a lower energy level to a higher energy level. When they return to their ground state, the lowest energy level of an atom, they release an electromagnetic wavelength that is interpreted as a specific color in the brain. In normal light, the wavelengths of all different frequencies are released in random intervals with no coherency from one wave to another. However, in lasers, the electromagnetic wavelengths released all have the same frequency, causing only a single color to appear. In addition to this, the wavelengths are in lockstep, meaning the troughs and crests of their waves are perfectly aligned, forming a highly focused beam of light. Because of this coherency between wavelengths, laser beams can remain focused for very long distances, even to the moon and back. This concentration and power also allows a tremendous amount of energy to be focused on an extremely small area. Surgical lasers are commonly ultraviolet, so their wavelengths have too high a frequency to be detected by the human eye. Ultraviolet wavelengths are only 10 to 200 nanometers, while wavelengths on the visible light spectrum are between 400 and 700 nanometers. Because these lasers are highly focused, the heat they generate can vaporize materials with high water content they come in contact with.
Laser eye surgery works by altering the shape of the cornea. The cornea works together with the lens to focus rays of light onto the retina. The cornea accounts for 2/3 of the optical power of the eye. It is the lens that changes shape by the action of suspensory ligaments and ciliary muscles in order to focus light originated from, and consequently the angle of incidence with the cornea. During a LASIK procedure, a corneal flap is created with the use of a microkeratome, precision surgical instrument with an isolating blade designed to cut an 83 to 200 micrometer thick hinged flap. The corneal tissue beneath this flap is exposed and reshaped by the surgeon to a specific predetermined pattern, which is completely round.
Light waves travel in straight lines at approximately 300,000 kilometers per second. When a light wave enters a medium or passes from one medium to another, its speed changes. The speed of light passing through glass is 200,000 kilometers per second, while the speed of light passing through water is 225,000 kilometers per second. If light travels at a perfectly straight line, parallel to the floor, when the beam switches between mediums, the speed of the particles will decrease, but the direction will not be affected. However, if the light is traveling at an angle, the speed will be decreased along and the direction will be skewed. Suppose the light ray was approaching glass at a 45-degree angle. The light would approach the medium with a speed of 300,000 kilometers per second, but as the light changed mediums, the bottom of the light particle would come into contact with the new medium before the upper portion of it would. This would cause the bottom half of the particle to travel at 200,000 kilometers per second, while the upper half of the light particle would travel at the original 300,000 kilometers per second. Since the different portions will be traveling at different speeds, the angle will be lessened to accommodate for the difference. As the light particle travels out of the glass, the same thing occurs but in the opposite direction, causing the light to bend back into its original position.
Normally, the cornea and lens bend or refract incoming light rays to focus them on the retina. When there is a refractive error, the cornea and lens cannot focus light rays on the retina. The eye normally creates a clear image because the cornea and lens bend or refract incoming light rays to focus them on the retina. There are three main accommodations that LASIK can help. Those include hyperopia, is if your cornea or lens isn't evenly smoothly curved. Light rays aren't refracted properly and you have a refractive error. Farsightedness occurs when your eyeball is shorter than normal or your cornea is curved too little. The effect is the opposite of nearsightedness. When light cannot focus the retina, causing faraway objects to appear blurry, is called myopia or short-sighted. Myopia occurs if the eyeball is too long or the cornea is too curved. Astigmatism occurs when there is either the front surface of your eye, the cornea, or the lens inside your eye has mismatched curves. Instead of having one curve like the round ball, the surface is egg-shaped. This causes blurred vision at all distances. Presbyopia is an age-related condition where the lens becomes more rigid and less able to change its shape to accommodate the light.
How can LASIK help athletes perform their best? LASIK is designed to correct a patient's vision to the level of his or her existing prescription, not provide radically different sight. Most recipients are pleased to be able to adequately play sports with clear vision and without the hassle of a contact lens or glasses. Without dirt or sweat getting into contact lenses, or a risk of an elbow or ball colliding with a competitor's eyeglass frames, there are fewer environmental factors that could affect an athlete's game. Your vision can fluctuate with contact lenses moving around, and your peripheral vision can be slightly distorted when you look at the edges of your glasses. Although it takes time for the flap to secure itself down, post-LASIK, most patients don't need to wait long to pursue athletics again. Those who enjoy low-contact pursuits, such as cycling, swimming, or baseball, can return to play in about a week. Like every medical procedure, there are side effects that may include a dry eye, which is a common result of refractive surgery. It may last for several months, but can usually be treated with artificial tears. Fewer than 5% of LASIK cases may be required a visit for enhancement or touch-ups. While rare, some patients may experience unwanted visual symptoms, such as induced glare or halo. Keep in mind that LASIK might not be the best option for all people. People who participate in high-contact sports, basketball players in particular, may consider photorefractive keratectomy, or PRK, a surgery that instead directly reshapes the surface of the cornea, avoiding the thought altogether. In a study comparing laser surgery to conventional surgery, published in the Journal of Cataract and Refractive Surgery, researchers found that those who had laser surgery had slightly better vision after procedures when compared to those who had conventional surgery.
The laser-assisted approach offers a myriad of advantages with safety, precision, and recovery time.
First, the use of a computer-guided laser means a surgical incision is up to 10 times more accurate than a corneal incision done by hand. Recovery is also smoother after bladeless laser-assisted cataract surgery.
If you are skeptical or have no idea whether to get a conventional or laser surgical process, choose laser. It will point you in the right direction.